Okay, so there's something pretty significant happening with kids' development here in America. This new CDC report, it just came out April 17th, 2025.
Yep, that's the one.
And it's showing a really concerning jump in autism rates.
It really is. So today we're going to, take a closer look at that CDC data.
Try and unpack what might be behind this rise and maybe ask why the mainstream reaction seems a bit muted
Yeah,
given the numbers.
exactly. The scale of it is what's really striking. The report says about 1 in 31 kids in the U.S. now identified with autism spectrum disorder. 1 in 31.
Wow. And it's not just here, right? You mentioned other places are seeing similar things.
That's right. Similar trends elsewhere. I saw an upcoming paper, it's on Substack, suggesting the rate in the UK might even be over 9%.
9%, goodness. And even within the U.S., it varies a lot.
Oh, definitely. Like you said, under 1% in Laredo, Texas. But then you look at California, and it's over 5%. Big range.
And we should remember, autism, it's a spectrum. It looks different for different people. But the CDC did say, over 60% need special education support.
Yeah, over 60% require special needs education. And for, a pretty significant chunk, maybe 25%, the challenges are really profound.
Like repetitive behaviors, sensory
Right.
issues.
Auditory processing problems, sometimes head banging, difficulties with basic things like toileting. It's tough.
And you contrast that with, say, when we were kids.
Yep.
What was the rate then?
Well, the estimates back then were something like 1 in 10,000, maybe.
1 in 10,000 versus 1 in 31 now.
Yeah.
That's staggering.
It really puts the change into perspective.
So it begs the question, doesn't it? What on earth could be driving such a massive increase?
Mm.
And maybe the bigger question, why isn't there this huge alarm bell ringing everywhere? In the medical world, in the media.
Right. Because the CDC report itself, its main conclusion seems to be, well, we need more resources to manage this.
Not so much. Let's find out exactly what's causing it.
Precisely. Less focus on the why. So, okay, let's dig into that. It's probably not just genetics, right?
Yeah, people talk about genetics, but it's more like a predisposition, isn't it? Not one single autism gene.
Exactly. There are common genetic variants, sure, that might make someone more susceptible, but those underlying factors, they probably haven't changed that dramatically in just a few decades.
Okay. What about other known risk factors, like parental age?
That comes up. Men over 40, women over 35 at conception. That's seen as a minor risk factor. But again, probably not enough to explain this scale of increase.
And premature birth. That's often linked to developmental issues.
Definitely a significant one. Several big studies, meta-analyses, they suggest around 20% of babies born early, before 37 weeks, are later identified with autism.
20%. Wow.
Yeah. It seems to be something that develops maybe between ages 2 and 8, not something they're born with necessarily. But even putting prematurity and parental age together.
It still doesn't quite seem to match the speed and size of this surge we're seeing now.
Right. So logically, you start looking at what else has changed significantly in that same time frame.
And this is where the conversation often turns towards vaccines, specifically the way they're given now, multiple shots together.
It's hard to avoid that discussion, especially when you look back.
Oh.
Leo Kanner, who first described autism back in 1943, he actually noted some children regressing after the smallpox vaccine.
Huh. I didn't know it went back that far.
Yeah, Kanner himself mentioned that temporal link. And of course, this leads us into the whole very contentious history around Andrew Wakefield and the MMR vaccine.
Oh, yeah, I remember that. It caused a huge backlash. Wakefield was pretty much discredited everywhere.
He faced immense dismissal, absolutely.
And honestly, like a lot of parents back then, my wife and I, we just followed the schedule, got the kids vaccinated, didn't really question it. That was the advice.
That was the prevailing approach for sure.
But seeing these new numbers now, it kind of makes you reconsider things, doesn't it? Makes you wonder if maybe something in that original observation got lost in the controversy.
Well, let's think about the basic science, how vaccines work, how they stimulate the immune system.
Okay.
Is it unreasonable to ask if giving, say, multiple vaccines combined in one shot, especially to a very young infant whose immune system and brain are still developing really rapidly, could that trigger a different, maybe more intense immune reaction compared to getting single vaccine spread out maybe later on?
Like how it used to be more common. When we were kids, it was more single shots, wasn't it?
Generally, yes. Single antigen vaccines were more the norm. Now, babies get many more vaccine products, often bundled together very early in life.
So the thinking is maybe this bigger immune activation happening right during a critical window for the brain's wiring. Maybe that's a key difference.
It could be. Because like we said, the genes haven't changed this fast. Premature birth rates haven't exploded like this either. But the number of vaccine products given in early infancy has gone up significantly.
Right. Yet exploring that possibility seems difficult, almost taboo in some circles.
There does seem to be a real reluctance in mainstream medicine and media to investigate this potential link thoroughly. And, this isn't the first time in medical history that important observations have been pushed aside.
You mean like with Semmelweis and hand washing?
Exactly. Ignaz Semmelweis basically figured out doctors needed to wash their hands to prevent childbed fever, and he was ridiculed for hymns. Or Sir Austin Bradford Hill, proving the smoking lung cancer link. That took ages to be accepted by everyone, despite the evidence.
Because it challenged established practices or powerful interests.
Often, yes.
Mhm.
Prevailing beliefs can be hard to shift.
And you see a parallel there with Wakefield. His Lancet paper, it stood for over a decade before it was retracted under pressure, and his career was essentially destroyed.
It's a comparison worth considering, given the initial observation and this subsequent reaction.
So, okay, let's pivot slightly. What are the bigger implications here for society if these numbers keep climbing?
Well, it's potentially a massive societal shift, isn't it? This isn't just a medical issue. We're talking about a growing number of people who may need significant lifelong support.
Especially the 25% you mentioned with more severe manifestations.
Right. It impacts education systems, social services, families, the economy, the ability of a large segment of the population to live independently.
Mhm.
It's a huge demographic trend we need to think seriously about.
Yet the general alarm level seems
Mhm.
low. I remember seeing a CNN interview. It was with a mother whose child has autism,
Mm-hmm.
and the whole focus was on coping strategies, how she manages day to day. There was almost no talk about why her child had autism. It felt like resignation almost.
That's something you do see. Perhaps people feel overwhelmed, or maybe the narrative discourages asking why. And look at the research funding. For a condition affecting 1 in 31 kids,
It's underfunded.
grossly underfunded, many would argue. We don't have those really big long-term perspective studies, the large randomized trials you'd ideally want to tease out causes and risk factors. And drug development specifically for core autism symptoms is pretty limited too.
You also brought up something interesting before, a possible link, or correlation maybe, between the rise in autism and the increase we're seeing in young people identifying as transgender. How might those be connected?
Well, it's complex and needs careful research. But some studies have suggested a correlation. We know that individuals with autism often face real challenges with social communication, fitting in, peer relationships.
Which could lead to feeling isolated, maybe ostracized.
Exactly. And that isolation might make them more vulnerable, perhaps more suggestible, maybe spending more time online where they encounter certain ideas or communities. Some research has found that a noticeable percentage of youth seeking gender transition also have autistic traits.
So it's not saying one causes the other, but maybe there are shared underlying vulnerabilities or factors at play, like difficulty navigating complex social world.
That's one hypothesis being explored. It raises questions about development, identity formation, and societal influences.
It does feel like part of potentially a bigger picture. You used the term anti-humanism earlier. Could you expand on that? You linked it to things like transhumanism, AI.
It's more of a philosophical observation, perhaps. But when you see trends that seem to push towards merging humans with technology, or sometimes implicitly devaluing biological norms, or even suggesting, like some transhumanists do, that baseline humanity is something to be overcome, it makes you wonder about the underlying values. Is there a subtle shift away from valuing innate human biology in development? That's the kind of anti-humanist undercurrent I was referring to.
But you also made the point, and it's important, that for some people on the spectrum, especially maybe those with Asperger's or high-functioning autism, the online world can actually be a really good fit.
Oh, absolutely. For individuals with particular talents, maybe in tech, logic, systems thinking, the online space can be incredibly empowering. It allows connection based on shared interests, sometimes bypassing difficult social cues. That's definitely a positive aspect for some.
Okay. But that doesn't take away from the concern about the sheer number of diagnoses overall.
Not at all.
Let's go back to the onset pattern you mentioned. Parents reporting a normally developing child, then vaccinations, then maybe a high fever, perhaps a seizure, and then regression.
Yes, that sequence is described very frequently by parents whose children go on to be diagnosed with autism. It's anecdotal, but the pattern is consistent in many accounts.
And the biological mechanism there could involve inflammation, cytokines.
That's a leading theory supported by a lot of research now. We know high fevers trigger a release of inflammatory molecules called cytokines. These can cross the blood-brain barrier and affect brain function and development. There are, I think, over 200 peer-reviewed papers now linking immune system dysfunction and inflammation to autism.
And you mentioned a specific study linking fevers or febrile seizures to later neurological issues.
Yes, a significant Swedish study by Nielsen. They found that children who had a febrile seizure, that's a seizure triggered by fever before age 9, had about a 40% increased risk of developing neurological disorders later on,
Including autism.
including autism, ADHD,
Oh,
and
yeah.
idiosyncratic disorders. And febrile seizures are relatively common in young children, often after vaccinations. So that finding seems quite relevant to the increasing autism rates.
And it's not just autism rates going up, right? You said things like beta tics are also more common.
That's another key point. We're seeing increases in other related neurological conditions too, which argues against the idea that the autism rise is purely down to better diagnosis or broader criteria. Something seems to be affecting neurodevelopment more generally.
Okay. So this evidence, these patterns, they seem to clash with what you called vaccine ideology. Can you explain that term a bit more?
Well, vaccine ideology refers to a kind of deeply embedded belief system, almost an article of faith for some, in the inherent goodness and necessity of vaccination, sometimes to the exclusion of critical questions.
Like it's beyond questioning.
Almost. If you look back historically, Edward Jenner and the smallpox vaccine, it was revolutionary, no doubt. But the scientific understanding of immunology and disease was minimal back then. Confirmation wasn't always rigorous. There seems to have been, and perhaps still is, a degree of maybe hubris, a belief that science can always improve on nature's immunity without fully understanding all the potential consequences.
You even mentioned a papal coin, showing vaccination replacing the Eucharist.
Yeah, I saw that image once. It's a striking symbol, isn't it, of how central, almost sacred vaccination became in some mindsets. But we should also remember resistance isn't new either.
Right, the anti-vaccination leagues back in the UK.
Exactly. During the smallpox era, there was huge public pushback against mandatory vaccination laws by groups like the Anti-Vaccination League opposing the Imperial Vaccination League. These debates have a long history.
What about aluminum? That often comes up. Elevated levels found in the brains of some children with autism. That sounds worrying.
It is worrying, absolutely. Aluminum is a known neurotoxin, and its presence as an adjuvant in many vaccines is a legitimate area of concern that needs more research. However, in my current assessment, looking at the timing and the biology, the primary driver of the autistic changes seems more likely to be that acute inflammatory response, we talked about the cytokine storm, triggered by the vaccination event itself, especially if there's a high fever or febrile seizure involved.
So the inflammation is maybe the bigger immediate trigger than the aluminum itself, in your view.
That's how I currently see the weight of evidence leaning. The immune system's reaction seems key. That's not to dismiss concerns about aluminum accumulation, but the acute event seems more directly linked to the regression pattern many parents describe. Maybe better education on managing fever safely could be helpful too.
And this kind of concern, whether it's the inflammation or the aluminum or just the sheer number of shots, it seems to be driving more parental hesitancy now.
We're definitely seeing that trend. Historically, maybe 2.5% of U.S. parents decline vaccines for non-medical reasons. Now, that number is up around 10%.
That's quite a jump.
It is. And there was that data from the Florida Medicaid program.
Right. What did that show?
It was observational, so we can't draw firm cause and effect conclusions.
Yeah.
But it found the autism rate among unvaccinated children in the program was about 1.1%. Among vaccinated children, it was 2.9%. And it was even higher for kids who had more vaccine visits.
Observational, yes, but that kind of difference definitely makes you think and calls for more rigorous studies.
It absolutely warrants proper, unbiased investigation.
Which brings us back to the question, given all this, the soaring rates, the biological plausibility, the historical context, the parental reports, even suggestive data like the Florida study, why does the official response seem so muted? Why isn't there more urgency?
That is the multi-billion-dollar question, isn't it? It's puzzling. You have figures like Robert F. Kennedy Jr., who's been raising alarms about vaccine safety for decades, now in a very prominent position.
Yet, are we seeing any major shifts in vaccine policy, especially with the newer mRNA ones?
Not really. There doesn't seem to be a fundamental reevaluation happening at the policy level. It's quite extraordinary.
And you mentioned that JAMA paper suggesting medical schools should recruit autistic applicants. That seems like a bizarre response to a crisis.
It's astonishing, really, almost like accepting this as the new normal instead of trying to prevent it. And meanwhile, You still see major medical journals routinely citing Wakefield's retracted paper as the final word, dismissing any link decades later.
It feels like a closed door. And what about those Bethesda meetings you mentioned, the ones with NIH, FDA, CDC, industry,
Yeah.
focusing on emerging health issues?
Those meetings, which were a forum specifically designed to review data on things like autism and vaccine safety concerns, were suspended some years ago and haven't been restarted.
So a key platform for discussion is just gone.
Apparently so,
Hmm.
which is concerning when you need open discussion.
And you contrast this official silence or inaction with what you hear anecdotally about COVID vaccine side effects.
Well, just talking to people, it's remarkable how many, I'd estimate maybe 85% based on my informal conversations, say they know someone personally who suffered a significant injury, developed a disability, or even died following a COVID-19 vaccination.
85%. That's huge, even anecdotally.
It suggests a vast gap between public experience and the official narrative on safety and adverse events.
And yet, in some places, they're still pushing these vaccines hard on very young children. You mentioned Brazil.
Yes, reports from Brazil indicated potential fines or even imprisonment for parents refusing the COVID vaccine for their children. This is happening despite serious questions about the necessity, efficacy against transmission, and long-term safety profile for young kids.
So what is driving it then? Is it just profit? Is it that vaccine ideology you talked about, or both?
The profits have been astronomical, unprecedented, that's undeniable. So financial motives are likely a factor.
And maybe not the only factor.
Probably not. That deep-seated belief, the ideology, likely plays a role. And maybe there's also a psychological barrier. It must be incredibly difficult for doctors and institutions to confront the possibility that something they strongly advocated for and maybe even received themselves could potentially cause harm.
Like the doctors who smoked for years denying the link to cancer.
Exactly. It's a powerful psychological parallel. Denial can be a strong force when your own beliefs and actions are implicated.
You also touched on SARS-CoV-2 itself. Some people question if it even existed or was dangerous. You see it differently.
Oh, I absolutely treated patients who were very sick with COVID-19. It was a real clinical entity. My concern isn't about denying the virus, but about the responses enacted in its name.
The lockdowns, the mandates.
The massive transfer of wealth, the erosion of freedoms, those are the aspects that I find deeply problematic and questionable, regardless of the virus's origins or specific danger level.
And looking ahead, you raised concerns about the ongoing work in high-security labs, BSL-3, BSL-4 labs.
Yes. The research creating potentially pandemic-capable pathogens continues, and the oversight often seems inadequate. When you hear figures like Tedros at the WHO or Peter Hotez talking about preparing for an inevitable disease X.
It makes you wonder if they know something we don't, or if they're involved in creating the threat and the solution.
It concentrates immense power, doesn't it?
Yeah.
The ability to potentially create a pathogen and also control the countermeasures. That lack of rigorous independent oversight is a major global risk.
What about Klaus Schwab stepping back from the WEF? Is that a sign things are changing?
I'm skeptical it signals a fundamental shift in their agenda. It feels more like a restructuring, perhaps putting a new face on things.
But the core ideas remain.
I think so. You still have influential figures like Yuval Harari talking about transhumanism, about potentially useless populations in an AI-driven future. The core concepts in Schwab's books, The Fourth Industrial Revolution, The Great Reset, outlining social engineering, surveillance, potentially a global governance structure. Those ideas seem very much alive within that movement.
So that underlying anti-humanist theme, as you called it, persists.
It certainly seems that way from their publications and stated goals. A vision of a future engineered by a select elite, perhaps less focused on individual autonomy and traditional human values.
So if the WF agenda continues and governments aren't really tackling the autism crisis or vaccine safety questions head-on, who is going to fix this? It doesn't sound like any world leader is stepping up.
That's the crucial point, I think. Even with someone like RFK Jr. gaining influence, it's not clear that any single leader can or will solve these deep systemic issues. It seems increasingly like the responsibility falls back on us, on individuals.
To stay informed, to think critically, to make our own choices.
Yes, to understand what's happening. Perhaps that anti-humanism we discussed stems from a lack of a deeper, maybe spiritual grounding among some of these elites, viewing humans as merely biological machines to be upgraded or managed.
You mentioned Pastor Art Pawlowski. His experience seemed to highlight the potential for extreme responses when core beliefs clash.
His situation in Canada, facing repeated arrests and persecution for holding church services during lockdowns, shows how intense these conflicts can become. It feels in some ways like a struggle over fundamental values, maybe even good versus evil, depending on your perspective. And it underscores the need for individual courage and awareness.
It really does feel like we're in uncharted territory, dealing with issues that are profound, maybe even existential.
These are astonishing times, no doubt about it.
And the importance of independent voices, of critical thinking, of just trying to understand this incredibly complex picture, it feels more vital than ever.
I couldn't agree more.
So just to kind of wrap up where we've landed, the data is clear. Autism rates are soaring, that's undeniable.
Yes, the CDC numbers are stark. 1 in 31.
And there are plausible biological mechanisms and observational data, like the timing of regression, the inflammation links, the febrile seizure connection that point towards vaccination practices, especially early combination shots, as a potential major contributing factor that needs urgent, unbiased investigation.
The science pointing in that direction is accumulating, alongside decades of parental reports.
Yet the official response seems, well, inadequate. A lack of urgency, limited research funding into causes, dismissal of dissenting voices, suspension of key discussion forums.
It's a disturbing disconnect between the scale of the problem and the institutional response. That gap is what's truly concerning.
It leaves you, the listener, with a lot to process. You mentioned historians looking back. What will they make of this era?
It's a powerful thought experiment. Will they see this as a time of collective blindness or willful ignorance, perhaps?
And maybe the more immediate question is, what do we do with this information now? How do we navigate this?
It really comes down to individual responsibility, doesn't it? Seeking out information, questioning narratives, making informed choices for ourselves and our families.
So we really encourage you, if this has sparked your interest, look into it further. Read the CDC report itself. Explore the history canner, Wakefield, the early vaccine debates. Think about this concept of vaccine ideology.
Become your own researcher, in a sense. Don't just take anyone's word for it, mine included. Look at the data. Consider the arguments.
Absolutely. Well, thank you for joining us for this deep dive today. It's clear the learning doesn't stop here. We'll keep exploring these crucial topics.
Thanks for the conversation. Important issues to discuss.